December 4th, 2024. Early morning. Brian Thompson, the CEO of United Healthcare, is gunned down outside his Manhattan office. The bullets left behind carry a message: deny, depose, defend. A chilling reference to the tactics used by healthcare companies to maximize profits. But what's even more shocking, the public's reaction? Instead of outrage, Americans respond with indifference. Why? Because Brian Thompson's death becomes a symbol of a much larger problem, a healthcare system that has failed its people. Minus $5 trillion, the U.S. spends nearly $5 trillion on healthcare annually, more than any other country. 18% of GDP, healthcare consumes 18% of the U.S. economy. 3 years lower U.S. life expectancy is 3 years lower than comparable nations. Americans spend more on healthcare than anyone else in the world, yet they see doctors less often, live shorter lives, and face worse health outcomes. How did we get here? To understand, we need to break down the 3 pillars of the U.S. healthcare system: insurance, providers, and pharmaceuticals. Health insurance, a system built to deny. Let's start with health insurance. 92% of Americans have some form of health insurance, but the system is far from straightforward. Unlike most developed nations, where a single payer manages healthcare, the U.S. relies on multiple insurance providers, each with its own set of rules, billing codes, and networks. This complexity isn't just frustrating, it's costly. In fact, 40% of hospital expenses are tied to administrative tasks, not patient care. That means nearly half of every dollar spent in hospitals goes toward paperwork, not medicine. But the problems don't stop there. Insurance companies deny 16% of all claims. For giants like United Healthcare and Medica, denial rates soar to 32% and 27% respectively. This means that nearly 1 out of every 5 times a doctor tries to provide care, an insurance company rejects it. Why? Because denying claims is profitable. Less than 1% of denied claims are ever appealed, and even when they are, 75% of Medicare Advantage denials are overturned. But by the time a denial is reversed, the damage is often already done. The human cost of this system is staggering. 67% of all bankruptcies in the U.S. are linked to medical bills. 40% of Americans have delayed or avoided care due to costs, often with life-altering or even fatal consequences. This isn't just a financial issue, it's a moral crisis. Insurance companies are incentivized to deny care even when lives hang in the balance. The system is designed to prioritize profits over people, leaving patients to suffer the consequences. Healthcare providers, profit over patients. Next, let's talk about healthcare providers. Doctors in the U.S. are among the highest paid in the world, but there's a catch. There aren't enough of them. Decades ago, the American Medical Association, AMA, lobbied to reduce the number of medical schools and cap residency positions, fearing an oversupply of doctors. The result? A severe shortage of physicians. Today, the U.S. has 2.6 doctors per 1,000 people compared to the OECD average of 3.7. This artificial scarcity drives up costs, making healthcare more expensive for everyone. But the problems don't stop with doctors. Hospitals and clinics are consolidating at an alarming rate. Over the past 20 years, there have been more than 1,000 hospital mergers. Today, 3 out of every 4 doctors work for a corporate group or hospital, rather than running independent practices. Private equity firms have entered the fray, buying up clinics and hospitals to cut costs and maximize profits. While this might sound efficient, the reality is far darker. Studies show that private equity ownership leads to worse patient outcomes. For example, nursing homes owned by private equity firms have a 10% higher short-term mortality rate. Hospitals acquired by private equity see a 25% increase in complications and a 38% rise in bloodstream infections. Cutting corners to boost profits comes at the expense of patient care. Even nonprofit hospitals, which are supposed to prioritize community health over profits, have fallen victim to greed. Take UPMC, a nonprofit hospital system. In 2022, its former CEO made nearly $13 million. When questioned about his exorbitant salary, he simply said, "That's your judgment." This mindset, where executives prioritize their paychecks over patient care, has turned healthcare providers into profit-driven businesses. The pursuit of profit has overshadowed the mission of healing, leaving patients to bear the brunt of a system that values dollars over lives. The high cost of staying alive. Finally, there's the pharmaceutical industry. The US spends more on prescription drugs than any other country, 44% of the global market, totaling over $600 billion annually. But here's the shocking part. Americans aren't getting better or more effective drugs. They're simply paying more for the same medications available elsewhere. For example, the cancer drug Gleevec costs $90,000 more per year in the US than in other countries. Why? Because, unlike most developed nations, the US government does not negotiate drug prices. Instead, pharmaceutical companies are free to charge whatever they want, leaving patients to foot the bill. But high prices are only part of the problem. The pharmaceutical industry is riddled with corruption. Drug companies pay doctors kickbacks to prescribe their medications. These payments come in many forms: speaking fees, consulting gigs, research grants, and even outright bribes. Since 2014, these payments have doubled, reaching $12.8 billion annually. These financial ties create a glaring conflict of interest. When a doctor is being paid by a pharmaceutical company, can they truly be objective about what's best for their patient? The answer is often no. This system prioritizes profits over people, putting lives at risk. The consequences are devastating. Americans pay exorbitant prices for life-saving drugs, while pharmaceutical companies rake in record profits. In some cases, patients are forced to choose between paying for their medications and paying for rent or food. Generic drugs, which should be affordable, often have wildly inconsistent prices. For example, the prostate cancer drug Zytiga has over 2,200 different prices in Medicare plans, ranging from $815 to $3,400 for the same medication. This lack of transparency and fairness is not just unethical, it's deadly. Pharmaceutical companies often justify high prices by pointing to the costs of research and development, R&D. While it's true that developing new drugs is expensive, the industry's profit margins tell a different story. Pharma companies consistently rank among the most profitable in the world, with returns on investment far exceeding those of other industries. The truth is, high drug prices in the US aren't about covering costs. They're about maximizing profits. And those profits come at the expense of patients who can't afford the medications they need to survive. Here's an expanded version of Part 5, the human cost, making it more impactful and detailed. The human cost. The human cost of this broken system is immeasurable. Behind every statistic is a real person, someone who had to choose between paying rent or filling a prescription, someone who avoided going to the ER because they feared the bill more than their symptoms. This isn't just a crisis of efficiency, it's a crisis of morality. Scene: personal stories and data breakdown. In the United States, 67% of all bankruptcies are tied to medical bills. That's 2 out of every 3 people who go broke, not because they were irresponsible with money, but because they got sick. Even those with insurance aren't safe. Half of all GoFundMe campaigns are dedicated to covering medical expenses. Imagine living in a country where crowdfunding is a standard backup plan for healthcare. But bankruptcy is just one side of the coin. The fear of medical debt leads 40% of Americans to delay or avoid care. Some skip routine checkups, others ration life-saving medication. The consequences? Cancers go undiagnosed, chronic conditions spiral out of control, and preventable diseases become fatal. A Harvard study found that 45,000 people die each year simply because they don't have access to timely health care. That's more than one person every 12 minutes, all in the wealthiest country in the world. And the burden isn't evenly distributed. Lower-income families, racial minorities, and rural communities are disproportionately affected. In some counties, hospitals have shut down due to profitability concerns, leaving people hours away from emergency care. Pregnant women in these areas are 50% more likely to die from childbirth-related complications compared to those in wealthier regions. For every dollar spent on healthcare, Americans get less than their peers in other countries. They pay more, wait longer, and suffer worse outcomes. This isn't just inefficiency, It's a failure of humanity, a system built on profit, not patience. And until real reform happens, millions will continue to pay the price. The U.S. healthcare system is a Lamborghini, fast, advanced, and luxurious for those who can afford it. But for most Americans, it's a broken-down car that leaves them stranded. The U.S. spends more on healthcare than any other country, yet it ranks last among high-income nations for health outcomes. Whether you believe in public or private healthcare, one thing is clear: the current system is a disaster. Deny care, depose dignity, defend profits. This is the mantra of the U.S. healthcare system. But it doesn't have to be this way. The question is, will we change it?